the spine and whether it's healthy or not healthy, we need to first of all appreciate the different constituents of the spine. The spine is not just made up of bones alone. There are many other things that constitute what I would call the spine. Okay, first, like I said, the bones, which you can feel in the back. Okay, but between each of these bones there is something that we call an intervertebral disc. Okay, so the bones are called vertebral bones, and therefore between each of them is that disc. That's why it's called an intervertebral disc. Okay, that's 2. 3, there are muscles that are on either side and on top of the spine. We call them paravertebral muscles, and these are helpful in determining where the spine should be. Okay, in addition, there are ligaments that connect individual bodies or individual bones of the spine together. Okay, and then we have, of course, the spinal cord. The most important role of this of the bones of the spine is basically to house the spinal cord. You understand? And therefore we have the spinal cord that is being housed inside the spine, and then there are small holes where nerves come off the spinal cord, just like branches come off a stem of a tree. So basically any of those things that I've mentioned can be unhealthy and can cause you to have an unhealthy spine. So the problem can come from the bones themselves, where the bones can get fractured, just like during an accident, someone falls off a motorcycle, someone is knocked by a car. Most likely the bones are going to fracture, or they're going to dislocate. One bone is going to go in front of the other or behind another. Muscles can get torn, okay, or they can get into a state of continuous contraction. We call that muscle spasms, okay, and that can cause you pain. We call that mechanical back pain syndrome. You understand? So the problem here is now coming from the muscles and not coming from the bones. Okay, most often that thing that is between the two adjacent bones, which we call the intervertebral disc, sometimes it can get displaced or it can slide backwards. Okay, we call it a herniated disc. When it slides backwards, it compresses onto either the spinal cord itself, or it can compress onto the nerves that are coming off the spinal cord. Okay, and that gives you symptoms of spinal cord compression or nerve root compression, which we call radicular symptoms. Okay, sometimes the soft tissues of the backbone or of the spine can get infected. You understand? So you can get an infection of the disc, which we call spondylodiscitis. That infection comes from the disc and it goes into the adjacent bodies, and then you start getting bones fracturing because they're so weak, the integrity has been compromised by the infection. And most often we see TB doing that. So we have what we call TB spondylodiscitis, where the TB bag is eating up the body and also eating up the intervertebral discs. But also we have common bacterial infections like Staphylococcus aureus. Basically, the ordinary bacteria can also infect the spinal cord. Okay, and lastly but not least, we have tumors, malignant tumors. So tumors can start from either the spine itself, like we have primary bone tumors that are affecting the spine, but we can also have tumors that come from elsewhere and come into the spine. Okay, often we see prostate cancer spreading getting into the spine, getting into the bodies of the spine, but also cancer of the breast, cancer of the ovary. Any cancer can come from elsewhere and basically attack and multiply in the bodies and in the tissues of the spine, and giving you a sick spine.